everyone. My name's Jenna.
My name's Paige.
And this is Ben. We are here to give you an example of proper post-mortem care. Point of care for after death is delivered in a respectful manner to preserve the dignity of the deceased and honor the family's preferences. Overall excellence in after-death care, supported by findings in literature, shows that care was respectful, dignified, and supported of family needs. In addition, nurses found after-death care to be a mechanism for coping with death experiences. One of the most frequent behaviors described by nurses was the preparation of the body and environment for family viewing. Nurses wanted to make the patient look comfortable and peaceful to give the family that last visual picture instead of that moment of deceasement. So we're going to give you a little run-through of how proper postmortem care is delivered. So this is our corpse here. So first we want to make sure there's no pulse, and just feeling for a pulse here isn't good enough, so we're going to auscultate real quick. And there shows that there is no pulse. So next we would take a Q-tip or something, one of those little swabs, and kind of clean the nasal area. Anything in the mouth, do some mouth care, things like that. Make sure the mouth is all clean, no mucus or anything like that. And then what we would do is we would place an absorbent pad underneath the patient. Okay. And at this time, after the pad was in place, we would give the patient a full bed bath. We would have proper supplies, washcloths, water, soaps, things to make them look as clean as possible. So like I said, the family can view them and they can be comfortable in their room.
Put a new gown on them as well.
Put a new gown, everything like that. And then after the family has come in and had their time alone with the patient, there's no usual time limit. At this point, we would prep the body to be brought down to the morgue. So first what we would do is we would tie the wrists. We don't want any ligatures on the wrists, so what we would do is we'd put some form of gauze or cloth on the wrists, like so. And then usually tie them with string. Don't want to be too tight. And then after the wrists are tied together, you would use another set of ties and place the arms across the chest like so. And now that the body's set, some people use the legs, they keep them together, but for right now we're not going to do that. And then at this point we would take the piece of tarp and we would cover the body completely like so. And then usually there's a zipper of some sort, and we would just zip up the entire body, and it's always 100% important that you tag the patient. So you put a tag usually on the foot area, and the body is properly brought down to the morgue.
So first we're going to touch on some cultural aspects. One form of Buddhism is that once the patient has died, there's no touching of the body for 8 hours, and you must turn the patient to the east before they die. IV lines will be cut 2 feet from the patient's body to give the family room to get to the patient. Sometimes monks come in for a chanting in order to guide the soul and spirit to the correct place. Next, we're going to talk about some legal aspects. Notification of the medical examiner that the death has occurred must happen. When the patient may be a victim of a crime, the medical examiner assumes possession of the body. Some other legal requirements include correct documentation of care, condition of the body at the time of the death, notification of next of kin, and you must return the patient's possessions to the family. Next, we're going to talk about care of the patient's body. A do not enter, inquire nurse's station sign should be placed at the door of the deceased patient's room. It is a responsibility to try to confirm this notification of the nurse. You want to position the patient flat in bed, close their eyes, and cover them with a sheet up to their chest. You want to leave all IV tubes, indwelling catheters, infusion ports, nasogastric tubes, tracheostomy, and other tubes in place, or at least clamped. You want to place dentures in the mouth if possible, and if they're already in the mouth, you just want to leave them there. The body can remain in the patient's room if the mortician is able to pick up the body without delay. Otherwise, the body should be transported to the morgue immediately. Consult with operations supervisor or patient care manager regarding time and transport issues. All deaths will be screened for appropriate referral to the medical examiner per identified criteria. Whenever a patient death occurs, a determination must be made as to whether or not reporting to any public agency is required. The circumstances of the patient's illness and the information known about the next of kin must be reviewed in order to determine whether notification of the coroner's office or public administrator is necessary. One legacy must be notified within 1 hour following any expiration to determine if the deceased is a potential organ or tissue donor. You want to refer to your hospital's policy and procedure on organ and tissue donation for this. It's the physician's responsibility to notify the family of the deceased, and it's the nurse's responsibility to confirm this notification. The chart, including the completed data of deceased and autopsy/tissue donation forms, will be taken to the body by escort, who will then deliver the forms with the chart to bed reservations. Lastly, we're going to talk about support for the family. You want to gather up equipment. Sometimes they have adult bereavement packets with checklists. Sometimes the family will ask for a cloth envelope for a lock of hair. To do this, you need a mortuary release form. You want to place the door card just above or below the deceased patient's room number, and you want to give the family time alone with the deceased if that's what they want. You need to be open to the family bathing or fixing the hair of the deceased, and you need to give them the option of, like I said, obtaining the lock of hair. And you want to escort the family members to a quiet room and be available to them until they leave the hospital.